Hello, kia ora, and welcome to today's session. My name is Nadia Davis, and I'm the Manager for Customer Training Services in Oceania. Our session today is part of our series for the Te Pūkenga libraries, and we're focusing today on the EBSCO Reference Centre, Nursing Reference Centre Plus, and an overview of the new Nursing and Allied Health reference source. By the end of today's session, you will be able to describe EBSCO reference sources, conduct searches on Nursing Reference Centre Plus, as well as browse content on Nursing Reference Centre Plus, and access EBSCO help resources. So we are going to start our session today with an overview of EBSCO's Nursing Reference Centre Plus product. This is a web-based nursing reference system designed to provide the latest evidence-based clinical information for nursing practice. It is really designed to locate evidence-based information at the point of care. So it is a point of care tool. It also includes a lot of unique content, such as images and videos, skills, competency checklists, even books and drug information. And if you're familiar with CINAHL, and CINAHL stands for the Cumulative Index to Nursing and Allied Health Literature, very popular in the nursing and allied health literature field, CINAHL databases are the most widely used and respected research tools for nurses, students, and allied health professionals. The content is peer-reviewed, it's evidence-based, and it does have substantial coverage of nursing and allied health disciplines. Well, the NRCP product is created by the same team of professionals who also created CINAHL. And the NRC Plus uses an evidence-based methodology for its content. And this methodology is outlined in my slide here. So our team of professionals will identify the evidence, they will select the best evidence, critically appraise the evidence, objectively report on it, synthesize the evidence, report conclusions and make recommendations. And when new evidence is published, they will then adjust any conclusions. So what content is available in Nursing Reference Centre Plus? So in addition to your standard journal content, there are care plans, core measure topics, images and videos, nursing management topics, regulatory topics, as well as risk management topics. Now that we've talked a little bit about the platform, we're going to do a tour. And I will encourage you to follow along with my session today. Bear with me for one moment. I'm just going to grab the URL and I'm going to pop this into the chat window along with a username and password so you can follow along with today's session. So you should be able to click that link and I'll just provide the name and password as well. If you have any problems with accessing the site, please let me know. But that should take you straight through to the Nursing Reference Centre Plus interface. Okay, so we're going to start off with a bit of a tour of the platform. I'm going to point out some of the options that are available there, what they are, and how you can browse them. Then we're going to do some specific searching for certain content, and I do encourage you to follow along. So this is the Nursing Reference Centre Plus interface. It does have its own special, unique, dedicated interface, but you can search for content like you would in a database as well. So we do have a search box. There is also an advanced search form here as well. If you use EBSCO databases, for example, you might have a My EBSCO account, a free folder option. You can also sign into your account in the top right, and you can also view your content. So if you do have a My EBSCO account, you can simply log in. If you do not have one, you can create an account by clicking on Create an Account from this page and following the prompt. I'm just going to go ahead and sign into my account. So if I needed to save anything, I'm able to do so. And now you'll notice in the top right that I am signed in. I have sign out appearing, and my name now appears in that top right as well. Okay, so in terms of navigation, what we're going to see on here is our spotlight. This will take us into content that is determined by our NRCP team. So you can navigate into things like managing chest tubes in adults. Just going to take you into this record here. It's a nursing practice and skill. If we go back to that page as well, we can navigate into any of these items. If you're interested in learning more about the editorial policies and that evidence-based methodology, the link is available here. So how do we identify the evidence? How do we select that evidence? How do we determine the relevance and the validity? How do we evaluate it? And so on. So all of that information is there at your fingertips. In the next part over here, we have some Nursing Reference Centre Plus features. There is a tour video. There is also a direct link into skills with videos, cultural competencies, management topics, care plans, and there is also a mobile app available for Nursing Reference Centre. There is also some videos that you can navigate through from here as well. At the top of the screen, there is some tabs, so we can search all areas. We can browse here for different diseases. Or again, we can search and limit to just diseases here too. We can browse or search for skills. So these are those skills and skill competency checklists, as well as some critical skills here and some featured videos. In the drug section, we can browse for different drug topics, including drug reference books, or we can search for a particular drug here as well. In the management tab, we can explore nursing management topics. So these will include things like decision making, strategic planning, so those really management style topics from here. We also have some direct topics such as clinical competency assessment, leadership and succession planning, and clinical decision making. And again, these are browsable, so you can click into these options. In the continuing education, this is part of Nursing Reference Centre Plus, but also part of the CINAHL databases as well. This is for continuing education. So it is an accreditor that will allow you to participate in these continuing education modules. And each of these modules will allow you to basically review the material, go through an interactive review, a test, and a module evaluation. And then after that, you'll get a certificate. You can view all of the continuing education course topics here as well, and they are usually flagged when we're seeing those results on Nursing Reference Centre. So that's our continuing education. In the drop down, we also have two additional topic areas, patient education. So these are really for patients. So if you have a patient and you're needing a handout for them on a particular disease, condition, or topic, you can view and access these quite quickly. And we have some top handouts, diabetes, wound care, and heart disease from here. And of course, you can browse through all of them as well. Our last little option for browsing is the books. So not only does it include content and that unique Nursing Reference Centre Plus content, it also includes some book information as well. So we have the drug guides that we saw earlier in the drug section, and we also have nursing care plans, diseases and disorders, and so on. The book content is here as well. If I was interested in looking at Davis's diseases and disorders, I can click on that topic, that book icon, that jacket, and it will take me in search from here, and I can then view each chapter within that particular title. Now, that is a quick tour or overview of the Nursing Reference Centre Plus. We're now going to head back to my slide deck, and we're going to be doing some example searches. So I've got a few examples we're going to look at here. My first one is a search for myocardial infarction in women. And I am going to use the general search to do this. So please follow along if you would like to. So I'm just going to do a kind of an advanced search. I'm going to use myocardial infarction or heart attack, and women, and risks or risk factors. So please do follow along. Now, you could do this in the standard search. I would use all areas. You could use diseases as well, but I prefer for this particular search to use the all area, so searching across everything. I will go into the advanced search, and again in the drop down, you can specify an area from here as well. So my search will be myocardial infarction or heart attack, and women or risk factor. You can also use your standard search tips, like using double quotation marks to search for your terms together in order, or you could use truncation, which in EBSCO is the asterisk. A truncation will allow you to stem a term. You could even use the question mark here for women, so it's looking for woman or for women. Our question mark is a single character wildcard. But let's go and run this advanced search. And the system will provide my results. Now, do note I have a substantial number of results for this particular search. And on the left-hand side is where we can focus and refine our search results. Now, for this topic, I've searched across all areas. And if we come down into our material types, I can very easily navigate into these different featured topics. For example, I might be a nurse that's out on the ward. I may choose the quick lesson because I have a patient in front of me that has acute myocardial infarction. So a quick lesson is like an overview, a workflow that guides the nurse through a particular topic or disease. And you'll notice it also has a CE module attached. So this is going to be part of that continuing education module as well. Maybe I'm after evidence-based care sheets for this topic. And again, I could navigate by checking the box here. Maybe a skill set, a practice and skill set. Maybe I'd like to view a video record for this particular topic. So here's a video now for mechanisms of post-operative vomiting and aspiration, forming a skin blanch, and so on. I may like to view some images about this topic, or even cultural competencies, related drug monograph information, patient handouts, care plans, those continuing education units, any legal issues, book content, research instruments, guidelines. And there is also a show button. So sometimes there might be a couple of extra options if you click on the show more. Under that, we can also limit by our major headings. So this will be based on the SANAL headings, and I can see myocardial infarction is the major heading for heart attack. I also have COVID-19, breast neoplasms, cardiovascular diseases, and so on. And again, we can click on show to view up to the top 50. Publication is listed here as well. Publication type. We also have some subsets like age, gender, nursing specialty. And I am searching not only Nursing Reference Centre Plus content, I also have Medline and SANAL in my Nursing Reference Centre Plus. So that is an advanced search. Now, what I am going to do is come into this quick lesson to show you this. I'm just going to click on the HTML full text, which will load the online viewer. So this is a quick lesson example. It's also taking me into other related information again on that same topic. So if I quickly wanted to navigate into a skill set or maybe a cultural competency or a patient handout, I can do that from here as well without having to go back to my result list. So from here, I can view this quick lesson. We have a description and etiology, facts and figures, risk factors, clinical presentation, assessment, treatment goals, red flags. What do I need to tell the patient or the patient's family? Diversity, equity, and inclusion information, our reference list, and our reviewers as well. So see at the top the authors and editors and also their credentials here as well. You'll also see that I can have this read out to me using text to speech. So there is some accessibility options around there. Sometimes people are busy, they haven't got time to read it, so you can have a listen to that online. We also have some tools over here as well, so we can set up alerts on certain topics. We can add these to that folder. We can print this record out. We can email it, save it, export the citation to EndNote, create a note, and generate a persistent link. So just scrolling through this quick lesson, here we can see the description or etiology, facts and figures, risk factors, clinical presentation, assessment, treatment goals, red flags. What do I need to tell the patient's family or the patient? We also have our reference list, and you'll note that there is a little code beside each one. And at the very bottom of this list, there is a coding matrix. So the references are rated using these codes, and these are listed in order of strength. So M being the strongest, it's a published meta-analysis, right down to our conference proceedings, abstracts, and presentations. So that is an example of a quick lesson. And again, you can navigate into evidence-based care sheets from here for this topic, skill sets, and so on. So advanced searching is available through the Nursing Reference Centre Plus interface. So these are evidence-based care sheets now. And I'll come down to atrial fibrillation. I'll just show you what this one looks like. It's HTML full text again, of course. And here is an evidence-based care sheet. So this is evidence around this topic, what we know, what we can do, DEI, references, and reviewers. Okay, again, each of these will have that coding matrix assigned to it. Okay, so our next topic we're going to look at is point of care. So let's just pretend we are a student nurse, we need to give a vaccination, but we haven't done it for a while. Utilizing the Nurse Reference Centre Plus platform, we can locate skill sets and things that also include videos that we can browse through. The easiest way to do this would actually be from the home page, going into skills with videos or even into your skills up here. Either way will be fine. I'm going to go in through this way and I'm going to add vaccination here in my search box. I'm going to use the AND Boolean and type in vaccination. So not every skill set will have the video, but if I'm seeing that spotlight featured result, these ones will include the video content. So here's vaccinating adults, and I'm going to go into HTML to open up the document. So this is the skill and practice set. I also have a link to a competency checklist as well as an interactive competency checklist. I also have my table of contents on the left-hand side so I can navigate very quickly throughout this. And if we scroll down, we can see things like standard post-procedure steps, signs and symptoms and allergic reactions, things that we should be aware of, any adverse reactions that we need to tell the patient. Scrolling down through here, though, it tells us what we need to know before performing vaccination. So these are very comprehensive. We also have a lovely image here that shows us where the injection site should be and how we can identify that on the patient. So nice visual images. And because this one also included the video, there will be a video embedded in here as well. So this is a little video on how to administer the vaccine. We can also full screen that video as well. So that is our skill set. So finding vaccinations for adults, again, browsing the option and locating that content very quickly, the Nursing Reference Centre. Our last example search we're going to use is cultural competencies. So in this case, we have a nurse who is working with a particular community and wants to familiarise with any cultural differences that may impact on providing healthcare. Now, her patient is of New Zealand Māori background. So what we're going to do is run a search for New Zealand Māori. I'm just going to come and click on New Search to go back to that original page. And just in all areas is fine. We could also go to skills if we wanted to as well. And we're just going to type in our patient's cultural background. And the first result that we get is providing culturally competent care. We also have the pediatric version. So we have both adults as well as children here. Now, these are evidence-based care sheets. I'm going to go into the HTML full text to show you what these culturally competent care documents look like. So we get a what we know about this topic. We've got historic and current cultural values, certain health conditions or disparities. And again, this is evidence-based, so this is evidence that's been consulted to create this document. Health beliefs, family participation, barriers to care, what we can do, any DEI information, and of course, we get that reference list and that coding matrix at the bottom of this as well. So that is a cultural competency, and you can use that same search. You can browse through all of the different competencies through the Nursing Reference Centre Plus interface as well. So before we go out of our Nursing Reference Centre Plus and have a look at our new Nursing and Allied Health reference source, I just wanted to show you again, just in the management section, if management is your area of interest. For any of these, we can browse the topics. This is going to run a search for us, and we can then navigate into certain material types, or we could add additional keywords in here as well. Okay, so I'm going to jump back to my slides and just pause here and see if anybody has any questions about that Nursing Reference Centre Plus product. Okay, so we will move on. If you do, feel free to use the chat panel. We're going to move on to the Nursing and Allied Health reference source. So we've looked at the Nursing Reference Centre Plus at the moment. Later on, EBSCO is going to be moving the Nursing Reference Centre Plus content, as well as the Nutrition Reference Centre, Rehabilitation Reference Centre, and Social Work Reference Centre into this one core product. It is on our new reference source interface, and I will show you today what this is going to look like. So the new version is a comprehensive resource that covers a wide range of health specialties. So it is nursing as well as allied health. And these specialties will include nursing, speech language pathology, physical and occupational therapy, respiratory therapy, as well as social work. The content will include similar content that we've just seen in the Nursing Reference Centre Plus. So our care sheets, quick lessons, clinical reviews, exercise sheets, skills with images and videos, quick lessons, research instruments, as well as textbooks and manual. Now it is on a new modern interface, and we will be taking a tour of this very shortly. I'm just going to go through some of the items that we're going to see when we get to the Nursing and Allied Health reference source. So similar to the Nursing Reference Centre Plus, you do have this option to browse through particular content. And we can see in our featured content collections, we have a link to our care sheets and plans. We have links into clinical reviews that help understand how to assess a patient. We have links into our quick lessons, our nursing skills and practice, and research instruments. So very quick ways again of locating content. Evidence-based care sheets that we've just seen in the previous version, this is a nutrition example, will provide an overview of evidence in terms of what is known about a disease or a condition and provides the best way to treat the patient, including the referencing matrix at the bottom, so that coding information. The clinical reviews are current comprehensive evidence-based reviews of the literature that are relative to a specific disease or condition. So this could be for physical therapy, occupational therapy, or speech therapy. Quick lessons, as we saw in the previous version of Nursing Reference Centre Plus, are clinically organised nursing overviews with information that is mapped to the nursing workflow. So these include that description or etiology, facts and figures, risk factors, red flags, and so on. So the quick lessons are that workflow. The skills and practice sets allows you to browse through those different lists of skills and practice papers, and you can filter your results in this new platform by the specific nursing specialty or using your keywords as well. And our research instruments are here too. So a research instrument is a measurement tool. So this could be something like a questionnaire or a scale or a survey that is designed to obtain data on a topic of interest from research subjects. So research instrument records are researched and created by CINAHL staff, and they provide information about the instrument, including the purpose, the population or sample that should be used, the variables, the methodology, and so on. So they provide the tool, and you can also search for instruments within the databases as well. Okay, and lastly, there is the option to browse through your core content. And as I mentioned, this new nursing and allied health reference source includes not just your nursing content, it also will include nutrition, social work, and rehabilitation. So the browsing of core content allows you to navigate directly into those top topics and then filter down into specific areas of interest. So now that I've gone through the platform, we will go and do a platform walk. And again, I will encourage you, if you would like to follow along, to please do so. The link for this is a little bit different to the other platform that we were looking at. So I am going to put the link in the chat window. Feel free to click on this. It is the same username and password, but you'll notice it does go to a completely different looking interface. So it is on our new modernized interface at EBSCO. So once you click on that link, you will land on a page that looks like this. So this is our new nursing and allied health reference source. Little bit different here. In the top right, you have access to your My EBSCO account. So just like in the classic version, you can sign into My EBSCO or create an account so that you can save your work for later. There is also the dashboard. So this is where we can save our records or our searches, access our recent activities such as search history, or manage our alerts, whether it's a journal or search alert, and our projects allow us to customize our saved content. In the research tools section, we can navigate into areas or topics of interest. In this example, I also am searching not just nursing and allied health, I'm also searching the CINAHL database here as well. So I do have a little bit more content than just the standard nursing and allied health reference source. Down here, we also have CINAHL headings, and I'm seeing that because I do have the CINAHL database searching, so I have access to the controlled vocabulary. We also have the subjects authority, which are coming from the Nursing and Allied Health collection. And of course, we can browse for terms to search on. We also have access to a help button, which will take us to the quick start guide to Explorer. And Explorer is the interface that this reference center is built on, or this reference source is built on. Coming back in here, we have a link to a research guide. So research and writing tips for students, as well as citation help. And we have a link to curriculum standards and something called the concept map as well. So the concept map allows you to browse and search for topics or concepts of interest. And you can build a search using this as well. So we are going to come back into our main platform, and I'm just going to go into the EBSCO logo to launch our topic overview page. Now, as I mentioned in our walkthrough, we have the evidence-based care sheets from here. So clicking on evidence-based care sheet will provide us with a list of all of those topic here. So we have fall, epidural, and so on. We can go into our filters to filter down by our major subject headings if we're looking for something specific, or even into our nursing specialty areas. So if I was in the nursing management specialty, I'll view just those evidence-based care sheets around nursing management. So here, things like coaching and mentorship and so on. To access these, I can click on the online full text. This will load the viewer. And here we can see what we know about the topic, what we can do, the coding matrix at the bottom as well. And in this version, we also have the option to translate this to another language. We do support a number of different languages. So we do have Te here. Once we translate, we can then also um, download the content as well. So here's my translated document screen. It does use an automatic translation program. We use Microsoft Translate, so we do indicate that, it is a machine translation. If we're in the original language, we can also have this read out to us using text to speech, and we can even download the MP3 to listen to the article or the record offline. And the last little button in here is our accessibility support. So this is for remediation for any user that might be have some impairment and this article does not work well with their assistive technology. We can request a more accessible version of this. And then lastly, we have some tools. So we can save the record to the dashboard. We can cite this by using the end text citation options. We can export the citation to EndNote, Zotero, or Mendeley, or any of these other options. We can add it to our project. We can share it, Drive or OneDrive, or create a shareable link. And we can even email this to ourselves, and we will receive the HTML full text as an attachment. And we can also download this here in HTML as well to read it offline. So that is an example of our evidence-based care sheets, and that is the example here of the management area. So I am just going to go back to EBSCO again, just going back to that main page. Reviews and lessons, very similar theme. This is about how to assess a patient. Let me just go back here. Care plans as well. So care plans here, how we can care for a patient. We've got impaired people, verbal communication impaired, mobility impaired, ineffective coping, and so on. Again, you can use filters. You can add your searched keywords in the search box as well to narrow that down. We also have skills and practice sets. And you'll notice when we run this search, we're finding both dietitian, nursing, social work, and just your skill competency checklists as well. So I would recommend if you're looking for something specific to use the advanced search and add your keyword in here as well. And that is the example there of our skill sets. So I have the research instruments, that these are measurements or tools that are used in research. So here I've got 500 different scales, questionnaires, and other materials or research instruments that have been used in research. So if I wanted to find a research instrument on coping, I can use my keywords and refine this way as well. So here are some research instruments about coping. I'm going to use this one here. These are available in online full text. And here it tells me the year it was developed, the purpose, the variables, the population, the question format, psychometrics, how to get it, and so on. Any modifications as well. And we have the references here too. So the research instruments are about those questionnaires or items that have been used to survey your samples. Okay, so that is just going back to the home page, that landing page, that topic overview, our research instruments. Okay, next down we have the discovering content by your broad terms and options. So I'm going to go into nursing today. In nursing, we can then filter down to a specific subset. There are 35 different categories in here. So just like we saw in the classic version of Nursing Reference Centre Plus, I can go straight into our cultural care. We can view all cultural care by faith, by heritage, or by theory. And again, we could also enter in our keywords as well. Okay. So just coming back to that main page as well, back into nursing. And again, if I was interested maybe in a disease or a condition, I can go ahead and select an option from the list. So maybe I'm interested in infectious diseases, viral infections. So this is not including pneumonia, and it is running a search here. So now I've got results here on these different bacterial viruses. Okay, so coming back to that main page, they are the topic overviews that are part of this new Nursing and Allied Health reference source. And scrolling down under that, we also have our common conditions as well. You can also navigate in by your body system. So if you're doing any research into a particular type of system in the body, the endocrine system, the lymphatic system, and so on, you can navigate into these as well and view those relevant topics. And you'll just notice a search is being conducted across the top of the screen there. Okay, so that is our new Nursing and Allied Health reference source. A bit of a quick overview for you today. There is also the advanced search options as well. And from here, you have filters that you can use as a pre-search. So we do have in the Nursing and Allied Health reference source publication options here. So we can go directly into our skill competency checklists, for example. I'll just do a quick search on this. This is a filter. Now we're viewing all of those skill competency checklists. And again, we could use our filters to focus down to a major heading, or we could type in our keyword as well if we're looking for something specific. So maybe I do want to look for vaccination. Okay, and then on the filter option, we can also review this by our source types or by our publication type, again here as well. Okay, so that is the new Nursing and Allied Health reference source. And just lastly, if there's any questions on this, please do let me know. And that's the end of our session today. So I will be sending out a copy of the recording and the slide deck a little bit later on. All right, well, thank you everyone. Have a great rest of the day.